we had an Unconference session here at the Civitas on sexual and reproductive data, reproductive health data, in the wake of the Dobbs decision, and what could the HIE community do in response to that in order to address some of the issues that are raised. And we talked about a number of things, including, where are the threats? I mean, certainly with patients using apps outside of HIPAA, but we even talked about how under HIPAA there are lots of ways that data can still be accessed from a HIPAA-covered entity in order to facilitate a law enforcement inquiry, especially if it's accompanied by a court order or a subpoena, and that those things are very difficult to deal with. And so there was great interest from the group in continuing the dialogue around what could be a set of best practices. Some very interesting ideas came out around policy options or options to sort of be prepared to fight back on court orders, particularly when they're coming from states where you're not a resident, but the state may be seeking information about, in order to facilitate a criminal investigation in their jurisdiction. But definitely what also came up was, can we do more to help patients who want to keep this data from being shared any further than their, home, their place where they received care? And since HIEs are accustomed to facilitating data exchange for good purposes, we need some solutions that allow for that data to be not introduced into an environment where there might be kind of more threat vectors, right? So that was extraordinarily helpful. What did we learn more recently about sort of efforts that we might be able to connect with?
Right, so there's also a lot of discussion about the technical opportunities to improve the granular segmentation of data that exists in various health IT systems. It was acknowledged that a lot of work has been done by a number of groups historically trying to look at how to segment data more specifically. And the good news is that a number of people who are involved in the current work in that space, which is the SHIFT group, are enthusiastic about picking up this work, focusing on use cases that involve data transmission to HIEs and trying to move that forward. So we've already had engagement from that SHIFT group, and I'm involved in that, and there's a real opportunity, I think, for members of the HIE and the DirectTrust community to get involved in that group, and we'll provide at the end of this video some contact information for where people can reach out to get more involved.
I think the real takeaway is that it will take a lot of good minds getting around this issue to not only protect reproductive health data and sexual health data, but also to give individuals more agency, autonomy over the use and sharing of their data, so that when data sharing is taking place, it's done so in an environment of trust. And that is really what I think that the building of that need for trust in this environment right now, with the risk that women are and pregnant individuals are feeling.
And their providers.
And their providers, thank you, absolutely. It's super important that we don't settle on a single solution right now, but we use these great minds to look at what can be done. Data segmentation is being done right now at various levels, and to build that and then add the policies, the regulations around better protections overall.
Yeah, I mean, the issue of needing to protect certain classes of data is not new, and there were lots of people at the Unconference that, sort of recognized that we have always had state laws of varying types, and then of course the Part 2 data, and so, but I don't know that ever before we've had a situation where data can actually be weaponized against people in the way that could happen in the post-Dobbs era. So that kind of ratchets up these conversations to a different level and creates an urgency.
It really does, and we can't forget that $35 billion of American taxpayer money has gone into creating EHR systems and interoperability. We cannot throw that investment away. We really have to think about how to address this in a better way.